Have you experienced that kind of injury during games or in any types of physical activity? Or have you witnessed that kind of injury during intramural meets or in your PE class? What did you do during that time? Did you just watch the scene? Did you help the victim? Or did you want to help but you lack of knowledge about first aid? Let me teach you the basics about first aid here in my class. I'm Sir Eljay, and welcome to a fun and exciting episode here in Physical Education 9. For today's episode, we're going to talk about the first aid for injuries and emergency in sports setting. Also, we are going to identify the importance of first aid. But before we proceed, I want you to get your paper and pen to write down the important details in our discussion. Are you ready? Great! First, I want you to answer the following questions and I will give you 5 seconds to answer each item. Let's start! Number 1. What immediate care should you provide when a person is injured or ill until full medical treatment is available? First aid or fracture? The answer is first aid. That is the first thing that you should do when someone gets injured. Number 2.
What do you call an injury that stretches or tears a ligament?
Strain or sprain? The answer is sprain. Sprain is considered as one of the injuries that usually happens in sports. Number 3. In primary assessment, we need to apply the ABCs, where C stands for blank. Circulation or compression? The answer is circulation. Due to pandemic, we can play our favorite outdoor sports like basketball, baseball, softball, volleyball, and many others. But we can do some physical activities like jogging, dancing, or high-intensity interval training, also known as HIIT. But what if, during the activity, some members of your family get injured? As a student, we should not only know how to play games, but also learn how to apply first aid when someone gets injured. Now, what is first aid? First aid is an immediate care one should provide when a person is injured or ill until full medical treatment is available. In minor cases, first aid is enough to treat the victim or patient, but for serious injuries like fracture or severe bleeding, first aid can help the victim to minimize the injury and alleviate the suffering of the victim. There are 3 objectives in first aid. First, to save lives. Second, to minimize injuries or to prevent them from happening. And last,
To hasten or promote recovery.
when someone gets injured, the first thing to do is to check the area or the scene if it is safe to conduct the first aid or not. If the area is safe, quickly perform the primary assessment. The primary assessment is a quickly checking of a person to determine his or her initial condition and whether there are any life-threatening concerns. The first thing to do in primary assessment is to check the response of the victim if he or she is conscious or not. You can ask him or her a question, or you just tap his or her shoulder to determine if he's okay. Then ask someone to call for help. Then if the victim is unconscious or not responding, apply the ABCs. Always remember the ABCs when performing the primary assessment, where A stands for airway, B stands for breathing, and C stands for circulation. In checking the airways, you should always open the airway of the victim. To open the airways, you should tilt the head and chin of the victim and open his or her mouth. Next, check for breathing. Check for normal breathing for 5 to 10 seconds, and you should put your ears closer to the mouth of the victim and feel the air coming out of the victim's mouth and nose while watching the rise and falling of the chest area. If the victim is breathing normally and his or her heart is beating, you can now check his or her circulation. Checking circulation means quickly looking at the person from head to toe for signs of life-threatening external bleeding. If there is an excessive bleeding, we should control or stop it as soon as possible. Again, when you are performing the ABCs, you should do it as quickly as possible because time is very important. After that, if the person is still unconscious but breathes normal, you can now move the victim into recovery position. Always remember that you should avoid rolling the person if doing so could worsen his or her condition. Example, if the victim's leg appears to be broken. As always, you should only move the person if it is safe to do so. Now, let's have some short quiz. True or false? Answer true if the statement is true and answer false if not. Number 1. Time is not important in giving first aid. Is it true or false? The answer is false, because time is very important in giving first aid. Number 2. When performing the primary assessment, the first thing to do is to check his or her circulation. Is it true or false? The answer is false, because in primary assessment, the first thing to do is to check the response of the victim. Number 3. To save lives is one of the objectives in first aid. Is it true or false? The answer is true. To save lives is one of the 3 objectives in first aid. Now, let's move to the secondary assessment. Secondary assessment is checking the person for other injuries after you do the primary assessment. In some cases, if the victim is conscious, we can skip the primary assessment and directly perform the secondary assessment. There are 3 steps in secondary assessment. First, asking questions. Second, checking the quality of the person's vital signs. And third, doing an injury check. In asking questions, you interview the victim and any bystanders at the scene to get more information. You can ask the following sample questions. These are the examples of sample questions. How do you feel? Do you feel any pain? Do you have any cuts or bruises? Are you allergic to anything? Do you take any medicine? What is it for? Do you have any medical conditions such as heart diseases or other illnesses? Has this happened before? When did you last eat or drink? After you ask the sample questions, you need to check the vital signs. You need to evaluate his or her level of responsiveness, breathing, or skin. After you check the vital signs, you need to proceed to the next step, which is to check the injury. The primary goal of this step is to carefully look for injuries that were not identified during the primary assessment. An injury check may involve a focus examination or a hands-on check depending on the comfort level of person and whether the person is responsive. To do a focus examination, first, explain that the purpose of the examination is to identify injuries. Number 2, ask the person if anything hurts or feels uncomfortable. Number 3, if the person indicates an area of pain or discomfort or concern, look at the area for signs of injury including discoloration or deformities. Number 4, if there are no signs of any injury, ask focused questions about how the person feels. If the person doesn't complain of any pain or tenderness, and there are no signs of injuries, ask the person to rest for a few minutes in a comfortable position. Check the quality of the person's vital signs and ensure the ABCs are still unaffected. A person's condition can change while waiting for the help. Do the following to provide continual care. Number 1, have the person rest. Number 2, help the person maintain a normal body temperature. Number 3, Monitor person's conditions and ABCs. And 4. Move the person into recovery position if necessary. Number 5. Give comfort and reassurance to the person. By doing these steps, you're helping the person to stay calm, and when the person is calm, it has psychological benefit like decreasing heart rate, reducing pain, stabilizing the blood pressure, relaxing the body muscle, and many more. I hope you enjoyed today's discussion. Once again, this is Sir Eljay. Always remember that accident can happen anytime and anywhere. That is why first aid is essential to each and every one of us. First aid is as important as our health. So don't go away because Teacher Tony will discuss about community and environmental health as we continue our lesson in MAPE 9.
Great day to all of you! You're still watching in your educational channel, DepEd TV. Let us make your body, your heart, and your mind healthy. With me, Teacher Tony. Join me as we discover more about communities and the environment here on our first learning episode. Together, we will shine. Here on Health Education 9. How are you today? I hope you're still doing great. But do not forget to always practice extra care because our communities are still affected by the COVID-19 pandemic. Speaking of communities, today we are going to define community and environmental health. But before we begin, let me ask you, what is your dream community? What characteristics would you like to have in your ideal community? And how can you make your community an ideal one? I'm sure that one of the characteristics you've mentioned is that it is a clean and safe place to live in, right? Because above all, health is very important. Now, listen up. To enhance your overall well-being, I am encouraging you to embrace this opportunity to gain health and environmental literacy. And that is our goal in this class. Earlier, I've asked you about the characteristics that you would like to have in your ideal community. Now, let's imagine and feel what it is like to be a community health assessment officer. They are individuals who conduct assessment of a particular community and identifies its strengths, assets, needs, and challenges. Wait, but before that, I feel like I need to have a quick costume change. Like this. Get a clean sheet of paper and a pen or any writing material that you have so we can get through this checklist very quick. Alright, we are now ready to evaluate the place where you live by examining its features. Analyze whether each item that I will be showing exists or functions in your respective communities. Write a check mark if it does. Now, number your paper with items 1 to 20 so you will be just placing check marks later on. I think you are now ready. Let's begin. Does your community have fresh and clean air to breathe? Have safe drinking water for all? Has clean recreational water? Has clean, dry, and spacious homes? Have suitable means of sanitation? Does your community provides people with access to nutritious food? Has less mosquitoes, houseflies, and other harmful insects? Have plants and/or vegetable gardens in several homes? Has a control of the sun's ultraviolet light exposure to keep risk to a minimum? Have a sewerage and proper means of garbage disposal? Does your community have limited amount or absence of smoke coming from cigarettes, vehicles, or factories? Have medical access and healthcare services for all? Have means of preventing contagious diseases? observes proper disposal of hazardous substances, provides access to quality education? Does your community implements peace and order control? Has a sense of safety and security? Has harmonized relationship among other individuals? Have good social interaction and means of communication? Preserves culture and tradition and recognizes faith of individuals? How many check marks did you have in your checklist? Based on the result, do you think you can consider the place where you live as a healthy community? If you are unsure or you are undecided, don't worry, because we will know more about the characteristics of a healthy community in our discussions. At this point, let me share to you the 10 characteristics of a healthy community according to the World Health Organization. Number 1. The physical environment is clean and safe. Number 2. The environment meets everyone's basic needs. 3. The environment promotes social harmony and actively involves everyone. Number 4. There is an understanding of the local health and environment issues. 5. The community participates in identifying local solutions to local problems. Number 6. Community members have access to varied experiences, interaction, and communication. 7. The health services are accessible and appropriate. 8. The historical and cultural heritage is promoted and celebrated. 9. There is a diverse and innovative economy. And number 10, there is a sustainable use of available resources for all. As a youth, I am encouraging you to actively practice your role to help your community to be an ideal and a healthy place to live in, especially in this time of the pandemic. Can we expect that from you? I hope that you have an affirmative response on this concern, and you are accepting the challenge of creating a positive change. For us individuals, how can we say that we are really healthy? Let us now define what health is. Health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. Now, I want you to look at the pictures on my sides. Which one do you think depicts a community? And which one refers to an environment? Well, the picture on my right is an example of a community, and the picture on my left is an illustration of an environment. Can you tell the difference between the two? Community is defined as a sociological group in a large place sharing one environment. It includes individuals and their families. Environment, on the other hand, broadly includes everything external to ourselves, including the physical, natural, social, and behavioral environments. Can we say that human health is affected by the condition of the community and the environment? Certainly. That brings us to the terms community health and environmental health. Let us use a Venn diagram to illustrate their similarities and differences. Community health is defined as the art and science of maintaining, protecting, and improving the health of all the members of the community through organized and sustained community efforts. The focus is on people. Environmental health, on the other hand, comprises those aspects of human health that are determined by physical, chemical, biological, social, and psychosocial factors in the surrounding environment. The focus is on the physical environment. They may be two different aspects and approaches, but one thing's for sure. The goal is to promote health literacy and improve the health status of individuals. I am sure that ideas and concepts about community and environmental health are crystal clear to you now. At this point, why don't we have another quick role-playing game? This is also a way to assess your understanding. I want you to imagine that you are presently working as a health expert at the World Health Organization. Like this. Wow, I think it's cool to be a health expert, even just for a moment. Oops. Thank you. Now, here's your task. Some reporters will have an interview with you about community and environmental health that is relative to what we are experiencing right now. Feel and imagine that you are really an expert. Use the knowledge you have learned from our discussions earlier. What will be your answer to the following questions? How do you assess if a certain community is healthy? What are the characteristic features of a healthy community? As a youth, how can you contribute in maintaining, protecting, and preserving health amidst the rising development of a community? I am confident that you will do great in answering those questions. Congratulations in advance. Your health teacher will check your activity answers. Today, you have learned that we need a safe, healthy, and supportive environment to achieve good health. The environment in which we live is a major determinant of our health and well-being. Always remember that education can create better opportunities for better health. I hope you enjoyed today's discussion. Next week, we'll be exploring how a healthy environment positively impacts the health of people and communities. Once again, I am Teacher Tony, and it's an honor to have taught, inspired, and empowered you today. Keep safe and make your health a priority. Sir Eljay and I will see you again on our next learning episode. Only here on DepEd TV.